And since it's a Thursday edition of the Bold Republic Radio Show, we're going to head all the way down to Cheyenne, Wyoming, where the guy whose name I finally got right, Charlie Katibi, is hanging by. How you been?
Pretty good, pretty good.
How'd you
Finally
survive
warming up.
How'd you survive the windstorm?
Barely made it, but I think we're making it through.
Okay, so you got to get used to these things out here. Have you experienced stuff like that storm before?
Yeah. But there's some growing pains nonetheless.
Yeah. Okay. I just want to make sure you were okay after all of that, because welcome to Wyoming, as they say.
Mm-hmm. I'm from Massachusetts, so
okay.
I mean we're used to this.
Now, here's the thing, Massachusetts, Charlie. I lived there for a while, as you know.
Yeah.
They got Wyoming beat on snow.
Oh, absolutely.
Yeah. I mean, it piles up there, but because when it lands in Wyoming, it just blows across the plain to Massachusetts. So,
yeah.
Okay, so you've been studying some of the problems that hospitals have been having.
Yeah.
And let's be clear about. I mean, this is not one of these snooze topics for people. Somebody goes to a hospital, and they were hoping that financially things would be taken care of, but the hospital is having financial problems. But don't they charge like $500 for an aspirin? What's going on, Charlie?
Well, the argument right now that hospitals are making is that there's a lot of people that are going into these hospitals and either choosing not to pay, or the hospitals are making a conscious choice not to charge them because they make too little. And right now they're using that argument that they are incurring these about $100 million in charges that are going unpaid for. They're making the case that we need to expand Medicaid so hospitals can be made whole from these debts and this uncompensated care.
So this is one of those that when you first hear this, you think, oh, that makes a whole lot of sense. I mean,
sure.
Come on now. I mean, the federal government is going to come in and just dump a bunch of money on the hospitals and we're good, right?
Absolutely. Yeah, that's the argument. What they don't say is that we're already paying a good portion of that. So about 40% of that $100 million. So about $40 million is already being taken care of. We're already paying for that through our property taxes. We're already paying a lot, and now that they're saying they need even more from us taxpayers to make up these debts, so that they can be even better financially.
Yeah, well, you see, but Charlie, I mean, hospitals, they're just a bunch of greedy doctors who ride around in Porsches and so on. So they could certainly cut their costs, right? You like the sarcasm there? How'd I do?
Yes, yeah, very good, very good. Well, I mean, you're not too off actually from the truth, actually, because even though they're getting $40 million from us, they're still asking for more. And what they're asking now is, let's expand Medicaid, let the federal government, let federal taxpayers pay for a portion of it, and let the state taxpayers pay even more. And then we can be made whole, because, I mean, the case that they're making is that these hospitals are just being shortchanged and they're on their last legs.
Okay, so let's get into the shortchanged bit, because this to me is where it really gets to be a whole lot of fun. There is a lot of cost in running a hospital. It's not just a matter of, you got to pay for the doctor, but you also got to pay for the nurse. Then there's the lights that you have to turn on. Dear Lord, the insurance, just the cost of the building alone, cleaning the building. I haven't even begun to scratch the surface here. It's very expensive to run all of that. Either can't pay or don't pay. So how do you cover that cost? And since we're talking about a Medicaid system that's running shy on money, they got to find somewhere to save. So do they shortchange the hospital?
Well, what Medicaid, it's an interesting argument these hospitals are making, because Medicaid is one of the leading causes of uncompensated care.
Right. They
only pay hospitals about 84 cents for every dollar of service they provide their patients, which means that Medicaid is responsible for 14% of all the uncompensated care. So what hospitals are telling voters and our elected leaders is we need a system that's shortchanging us to be expanded, to cover even more people. And they're not telling us that, I mean, this won't make the uncompensated care better. It'll in fact make it worse.
So do we actually have hospitals out there because of this Medicaid program that are on the verge of going broke?
I wouldn't say it's because of that. It's a variety of factors. Obamacare is a big one. They brought a lot of people that were really sick and they're using a lot of services, but it's Medicaid is in the completely wrong way to approach this. If they're creating the uncompensated care, we need a better way of reimbursing hospitals, especially for poor people.
Right.
Because if this system continues to burn through money, it's going to be cut. And Washington is seriously thinking about cutting Medicaid. The new speaker, Paul Ryan, he's said repeatedly in the past, hey, states don't expand Medicaid, because that reimbursement rate is something we have been seriously looking at. And when times get tough, it's going to take a hit.
I think you're getting a call right about now. I bet you I know who this is. This is Glenn, who's on the phone. Oh, dropped off. I know someone who wants to talk to you about this. If he calls back, I'll get you on, okay?
Oh, please.
Yeah. But, okay, this might one more time. Here we go. This is Glenn, who's on the phone.
Hey, Glenn, it's John.
Yes, go for it.
I am so glad that you're having Charles on the show today, and I rarely get to talk to him. So I just wanted to ask Charles, if we had a system that reimbursed the hospitals for the truly unreimbursed care, where all we reimbursed them for is like the medical disposables, which is the overwhelming majority of what's lost, and we could do that and it didn't cost much to do it. As an economist, how would he rate that? Especially if it was a system that couldn't be gamed. And I'll take my answer off here.
All right.
The best. So he was asking what's the best way to reimburse hospitals?
Yes.
Probably just giving the poor straight cash. I mean, the way Medicaid runs right now, they give people a card and they say, we have this, don't worry about it. So when they go into the doctor, they get the care. Now it's in Medicaid's hands to decide how much they're going to actually reimburse doctors for. And I think that's a terrible system. I think the best system is give people a voucher or something, have it rise with the rate of inflation or something, and let them negotiate with doctors with how much care they're going to receive. The doctor's going to say, hey, with this amount of money, we can find some places to cut costs. I think that's a much more humane way of offering care, and it actually takes into account what the patient is looking for, rather than just relying on this massive government program.
Right. Well, then, and I'm just going to play devil's advocate then. Don't you run into the problem of critics will say, yeah, but you're only giving them so much money. What if their problem is bigger than their voucher?
That is an issue. Unfortunately, but like we've talked about this before, there's a lot of inflated costs in healthcare. And to be perfectly honest, the way we deal with healthcare, whether it's through Medicare, Medicaid, Obamacare, or the private insurance market, we really have no idea how much all of this really costs. So if you just put patients directly in contact with their doctors, they can find ways to negotiate.
Sure.
We've done this. There's a surgery center in Oklahoma that's done this. They deal directly in cash. Direct primary care is a new model where patients pay a direct monthly fee for all their primary care. There are ways to get the market system, the capitalist system into healthcare. We just have to let it.
Well, would I be right in saying part of the reason that we don't know what healthcare really costs is because we have people, as you started out by saying, that'll go to the hospital and either can't pay or just walk away and don't pay. And so the patients that do pay end up picking up the cost. And that skews everything. Now we don't know what anything costs anymore because we're trying to cover people who either don't or won't pay.
Well, that's a whole nother layer of complexity. So what you're referring to is the fact that, Medicare and Medicaid, as they've run into budget problems, as the states have, and also Washington, they've been ratcheting down quietly and slowly how much they're reimbursing doctors. It's only now coming to light. But what that does is that forces hospitals to raise costs on the privately insured and the privately covered, so that they can cover their costs. Because the hospital is not just going to take lying down the fact that one of their customers isn't fully paying.
Right.
They're either going to stop caring for them, which they've done, which Medicaid has started doing, or they'll raise costs on other people.
Now, this is interesting. How does a local hospital, and I'm not talking about like a privately run hospital, but I mean just your regular local hospital, which has a lot of government ties that you see all throughout the United States. How can they turn and say, well, we're not going to accept Medicaid anymore?
Well, a lot of those aren't the ones that aren't accepting it. A lot of times it's the private practices. They're the ones, they don't have their hands in taxpayers' pockets. Yeah. They have to balance their checkbook every week, every month, every year. So a lot of times what they have to say is, hey, we can't afford to take on new Medicaid patients. And we're seeing that around the country. Various surveys have found that around a third of all the private practices and doctors refuse to take Medicaid patients because Medicaid pays them so little. And if you look at larger cities outside of Wyoming, that number is half. So about half the doctors in major cities are now saying, we can't take any more new people. And it's really tragic because states and the federal government are now promising these patients we're expanding the program to new people, when in reality, providers just aren't taking them.
Right. Now, tell me if I'm getting really off base with this one here, but it seems to me the president promised, that Obamacare was going to keep people from overwhelming emergency rooms with non-emergency problems.
Yeah.
But what happened, though, is when you take a look, if you do actually sign up for the Unaffordable Care Act, and you take a look at what your deductible is, well, these people can't afford the deductible. So what do they end up doing? They end up rushing to the emergency room where they know they can get taken care of and walk away because, well, they're either not going to pay or they simply can't afford to pay. So aren't the emergency rooms being overwhelmed?
Yeah, there has been no drop in emergency room usage. And in a lot of states, it's actually increased. And that is what you touched on is the primary problem with the entire idea behind Obamacare. Because the entire idea behind Obamacare is that there are these people that are free riding on our hospitals. These people are uninsured, they're too poor, and they can't, but they make too much for Medicaid. So they are going to hospitals and not paying for it. There are free riders. They were making a conservative argument. When in reality, Obamacare costs way more than what all that uncompensated care costs. Because all that uncompensated care nationally, if we're talking nationally, is $84 billion every year. But Obamacare is set to cost around $100 to $200 billion every year. So does that make sense that you're solving an $84 billion problem with a $200 billion solution? Does that make sense to you?
Yeah. Okay. Well, there's people out there. I mean, I am not, I'll just tell you right now, Charles, I am not really that good at math. That's my sister. She's an accountant. She can do, like columns in her head that you and I can't even imagine in our head. But somehow there's some kind of problem, mathematical deficiency in Washington, D.C. And I haven't figured that out yet. Think about this, because we got to step away to pay some of our bills and so on here. But think about this for just a minute. The solution, Charles, to the problem, and also, coupled with that. So what do we do then if our state decides to go ahead and expand Medicaid? Is that good or bad for our hospital system? We'll do that up next.
I'm Professor Burke from Farmers Insurance, and this is 30 Seconds of Smart. So you want discounts on your home insurance? Upgrade your roof. Upgrade your plumbing. Get a burglar alarm. Get a fire alarm. Combine policies with your spouse. Bundle your coverage. Quit smoking. And, of course, talk to farmers, because the more you know about home insurance, the more you can save.
We are farmers.
Get smarter about your insurance at farmers.com.
Stop by and see Lyle Austin, 201 West Lakeway Road in the Lakeway Professional Center, 686-5002. That's 686-5002.
Hello, Americans. Rod here with my Made in America store, Camel Plaza, Gillette, Wyoming, where all our products are, you guessed it, made right here in the USA. When you purchase a product here, you support American workers and local veterans. Let's bring America back to work. Don't forget your veterans. God bless America, and buy American. It matters.
Daydreaming, son. It's time to get prepared. Time to get off your sofa and run yourself down to Surplus Unlimited in the Gun Traders building. Oh, my 1, 2, 3, 4. 1, 2, 3, 4. Civilian soldier, they got everything you could need. That's right, the Surplus is unlimited. Surplus Unlimited ammo for babies and adults.
That's right, babies need camos too.
10 different styles of camo.
Oh, don't you look pretty.
550 cord, numerous colors, wool blankets, boots, hats, gloves, coats, shirts, tactical vests and belts, camping supplies, high quality army cots, and that hard to find P38 can opener. Save time, save money. Surplus Unlimited in the Gun Traders building. 801 Carlisle on the Douglas Highway across from the fishing lake. Gillette, Wyoming. Hey, honey, are you mad at me?
No, what makes you think that?
You kind of got steam coming out of your ears.
It's not coming out of my ears. I'm vaping, like smoking without the smoke. And Hothead Vapor in Gillette has more flavors than you can shake a stick at.
Hothead Vapors in Gillette, Wyoming. Electronic cigarettes, liquids, and accessories with a large selection of personal vaporizers, kits, mods, tanks, accessories, and over 260 flavors of e-liquids. 404 South Douglas Highway, Gillette, Wyoming. Open Monday through Friday, 10 till 8 p.m. Weekdays, 12 to 8. And no matter where you are, you can find great deals online at hotheadvapors.com.
So, you like vaping over smoking?
Oh, heck yeah. And no stinky mess. So many flavors, and it helps me relax.
Are you relaxed now?
Sure.
Good, because, well, I accidentally dropped the cigarette ash on your new shirt. Kind of burned a hole through it. All right, now there's steam coming out of your ears.
Hothead Vapors in Gillette, Wyoming.
Stan, why are you wearing a sweater with a bullseye?
Because it's hunting season.
Right, so...
And there are hunters everywhere.
Okay, but why the bullseye?
Well, if everyone's been shopping at Rocky Mountain Discount Sports...
Oh, right, that's bad.
The way I figure it, we don't stand a chance.
Oh, good point. We don't stand a chance.
Might as well give them a clean shot. With everything you need for hunting season, Rocky Mountain Discount Sports, with locations in Casper, Gillette, Riverton, Sheridan, and Cody, Wyoming. Nice knowing you, Frank.
You too, Stan.
Come on, don't act like you don't know how this works. Glenn sits in a padded room, talks to himself, and guess what? You're the voices in his head. It's really creepy, but it works. Let's get back in there. Glenn Woods is back on the air.
And back we go to Wyoming Liberty Group, and Charles Katibi is standing by, who's been looking into the whole hospital funding situation here. So Governor Meade in our state of Wyoming continues to talk about Medicaid expansion.
Mm-hmm.
So good or bad for the hospitals?
I don't have much hope if we did expand Medicaid.
Why not?
The rating agency Moody's actually looked into, and they looked into hospitals and states that expanded Medicaid and the ones that didn't.
Right.
And they wanted to actually put to the test and find out whether actually hospitals were any better off. And they found out that their profit margins were no different. There was no meaningful difference in terms of whether you expanded Medicaid or not. So I don't really see why we should be wasting all this money and putting people in a terrible healthcare program that does nothing for their health when it's actually not even making hospitals any more profitable.
Well, and my worry is because there's some hospitals, let's take a look at Illinois as one of the worst case scenarios out here. Well, Colorado had the same problem too.
Yeah.
So they expanded and people literally came from other states pouring across the border because, hey, if I show up in the state that's expanded, I can get all this free health care, if you will. And once again, it overwhelms the system. So the money that the state is promised, doesn't it fall short?
It does. It does. And we wouldn't be talking about this if there were people that were honestly knew how to manage the Medicaid program working at Medicaid.
Right.
Unfortunately, I mean, this has been terrible for hospitals. One hospital group, it's called Southern Illinois Healthcare, they lost $14 million caring for these new Medicaid patients. And that was because the program in Illinois pays them so poorly.
Yeah.
So a lot of them, there's been no increase in profitability, but a lot of them are just really buckling under these new costs.
How does the hospital still exist at that point?
Well, they have savings. As a hospital, you need to, by law, you need to have a lot more savings. There's probably going to be a lot more cost shifting in the future. They did reduce the amount of people that weren't directly paying, like the uninsured. But what they did was they went onto Medicaid and were still undercompensating them. And that's the point I was making earlier. And that's the fact that Medicaid is a leading cause of uncompensated care. And that you're not making hospitals any better off by putting people on this program.
Okay. So did you come up with some clever solution to all of this?
In a lot of ways, this is out of the hands of the states, including Wyoming. A lot of this has to do with what the new president is going to do, because Obama's not going to be making any changes to this law. It's an election season. Yeah. So it's going to come up to the new president, and it's going to come up to the speaker, because they're looking at a number of Obamacare repeal and replace plans. And a lot of this is going to have to deal, a lot of what they're looking at is block granting to the states, just sending the money to the states and getting them out of the Medicaid business and letting them decide what's the best way to affordably pay for people's health care while not bankrupting hospitals. But another idea, and this is one I favor more than block granting, is just voucherize the program and just give the money straight to the individual instead of, and just bypassing the states entirely.
Okay, but we still have the problem of the federal government is broke and getting broker all the time. So any kind of voucher program, however else you might do it, doesn't it eventually run dry unless DC gets its spending under control?
Well, DC's spending is out of control because these programs incentivize excessive care. It's a fee-for-service basis, so doctors and hospitals have every incentive to provide as much care as possible because you get more reimbursement. And I mean, as you ratchet down the program, the reimbursement per service, a lot of times what doctors will do and hospitals will do is accelerate how much services they provide to get more reimbursement. Right. So if you voucherize it, make it a fixed tax credit or fixed voucher or something like that, you will slow down these cost escalations and make Washington slightly more out of control.
Well, and then isn't part of it also, a lot of the reasons that these systems seem to be overwhelmed is because of the freeloaders. And there are those people who legitimately need these government programs. And so I have no problem with helping people who have a legitimate need. But the number of freeloaders, oh, dear Lord, if we can find a way to comb them out, wouldn't that solve a big part of the problem?
Yeah, I agree. And part of that would have to do with repealing the expansion, because what the expansion does, it expands the eligibility to everyone, whether they have children, whether they're single, even if they're working. So when before we had it to the truly needy, people with children, people that legitimately couldn't work and they couldn't get health care through their job. But with Medicaid expansion, it didn't matter if you actually needed it, which negated the entire premise of Obamacare, which was to help people.
You and I both know this was their idea to get to a single payer system anyway. So, and of course that would go bankrupt pretty much overnight. All right, running out of time here. You've written extensively about this and gone and spoken about it at different places. I've seen you. I've been with you. So where do people find your work?
You can go to wyliberty.org. I have a number of articles on the problems with Medicaid expansion, as well as what some solutions might be as well.
All right. As always, pleasure having you on. Thanks for joining us on the program. As we get updates, just get a hold of me. You know where I am.
Thanks for having me.